States. That one's much smaller than this. There's only like 2,000 or 3,000 people on the reservation. And everybody really does know everybody else's business, but still, as a medical professional, they couldn't disclose that information, despite this man screaming. And of course, the strange part was he had worked at the hospital before, and he knew what the rules were, and he knew what rules they were supposed to be following. But of course, in his case, he wanted them not to follow the rules. Confidentiality has to do with keeping information private, that is supposed to be kept private. And this is not the easiest thing in the world when we're dealing with a situation like Fort Belknap, where they had a very difficult time not gossiping about other individuals. Why maintain confidentiality? The potential for clients to experience stigma. Oh, he's depressed. Oh, he's nuts. You know, they get tagged with this, and all of a sudden, then every time you go down to the gas station, people are going, "Oh, here comes that crazy person." That's a stigma. Yes. Moral obligation for helping professionals to follow the ethical standards for a professional, and this is really quite important. You need to maintain your own professional standards, and your professional standards are going to tell you not to disclose this information, any information, and it's tough. It's really, really tough. But it's not so difficult when you're dealing with a situation where where nobody knows anybody else. If you're in a city situation, if you're in Phoenix, who knows anybody in Phoenix? I mean, there's what, 4 or 5 million people in Phoenix? I don't know how many people there are in Phoenix. But what's the probability of running into somebody that you have been counseling? Fairly remote, of course. So it's a little bit easier in that setting. It's much more difficult on a reservation in a rural town, in a rural setting. I used to live up in Montana in a county that had 7,000 people in the whole county, and that included the Fort Belknap reservation. But we lived in a white community off the reservation, and there was one counselor in town for all the people in the area. So you can imagine, everybody knew everybody else anyway, and here she is, she's counseling everybody. Eventually, she did something she probably wouldn't have done if she'd lived in a city setting. She married one of her clients. I know, that's against the law, or that's against the ethics of her organization. She's a social worker. Had a master of social work. She was an MSW. Anyway, she married one of her clients, and she married him while she was still counseling the guy, which is taboo. But of course, we were in a very rural setting. You know, he's the most likely guy. There's only 7,000 people. Otherwise, she would have had to have gone up into Canada and found somebody to marry. So he's about the only, you know, American that she could find to marry. Model of acting with discretion and keeping one's word, of course, and that's what you are telling them. We will not disclose this information. And of course, there are legal requirements for you to maintain confidentiality. With the expansion of technology, it is into all aspects of our lives. Communication has become more and more difficult to regulate. We have cell phones. I flew this weekend, and I was listening to people on their cell phones. Not really, but I'm sitting right there, and this person's screaming into the telephone right behind me. I thought I was part of the conversation. My goodness, I mean, they were were disclosing all this interesting information, but of course I had no clue who they were. But here I am, I'm listening to their cell phone call. Fax machines, of course, fax machines will print something out. A lot of times it's confidential information. This happens downstairs, something will print out, and I go in to pick up my stuff, and so I pick up that stuff, and I have to look at it to see whose it is. Is it Christine's? Is it Sarah's? Is it Irene's? Is it Marius's? Is it Miranda's? So potentially I could learn everything that's on that sheet of paper. So fax machines are another one. Answering machines, I don't know if you've ever listened to an answering machine. But we all get to listen to everybody else's answering machine downstairs because we have an office and everything echoes. So when Christine's having a conversation with somebody, I get to listen to what she's talking about. Yesterday, I'm sitting in my office. Before coming to class, I'm trying to figure out what the hell I'm going to say. Oh my God. Out in the hallway. Out in the hallway, HR stopped one of the chairs and was talking to him about somebody who had just quit. Now, normally, I don't listen to people's conversations, but they were loud, so I had no choice. I was listening to their conversation, and I found out that somebody quit. I think it was a basketball coach, if I'm not mistaken. He's my neighbor, you know, so I'm getting all this information just out in the hallway because it, you know, it echoes down there. Anyway, so I listened to all the gossip. Okay, so answering machines, of course, are very, very loud. So every time Christine hits her answering machine and gets a message, I get to listen to what Carlin's talking about. Carlin, of course, is married to Christine, so I get to find out what Carlin's thinking. Computers, you know, you leave your computer on. I had a friend that worked in a shop. This is up at Fort Belknap, and he was working on a shop and in a shop, and evidently he was watching pornography while he was at work, which is the dumbest thing in the world to do. But there were people that were walking past, and they could see his monitor, so they could see what he was looking at. Turned out. Anyway, so he got fired because he was looking at pornography, and they were offended because they glanced in and they saw him looking at pornography. Internet sites, of course, you need to be careful of what internet sites you're on. Sometimes if you click on and this happened to me, my wife accused me, Swedish women want to have sex with you. That was what the email message said. So my wife accused me of looking for Swedish women to have sex with. I'm not exactly sure where they are. They flying into Flagstaff or Albuquerque? I don't know. Anyway, internet site. So you have to be careful. And just clicking on an email, sometimes you get the oddest things. You know, John wants to communicate with you. You click on it, and he's got naked pictures of Swedish women, evidently. Anyway, so I'm not hot for Swedish women, not very hot anyway. And of course my wife called me on the phone and said, have you been communicating with Swedish women, you know, one of those kind of things. Anyway, I don't even look at that email address. It's her email address, it's not mine, so.
So what was your response?
My response? No. No? What does that have to do with me? Limit sending confidential material or over insecure lines. You have to be really careful as far as confidentiality is concerned. A lot of information, if you talk loudly, then you have to be careful that nobody gets the wrong information or gets the information that you don't want them to have. Boundaries are defined as borders that separate some types of entities. For example, parents have boundaries as far as their children are concerned. The children, of course, have boundaries as far as the parents are concerned. Systems tend to have boundaries. Clients have boundaries. Service providers and healthcare workers, everyone has boundaries. So what can I do? What can I do if I go into a room? When I was a laboratory technician, they would send me into a room to draw somebody's blood. Well, what happens if the person doesn't have any clothes on? What do I do next? Ask them to put clothes on? What if the individual is unconscious? Which has happened to me in the past. What do I do next? Do I ask the nurse to come in and cover the patient up, or do I just go ahead and draw the patient's blood? What do you do? There are boundaries that you're supposed to maintain. So how in the world, what do I do? What do I do? What happens next? And normally what happened next was I just drew the person's blood and took off as quickly as I possibly could. One time I was drawing blood gases on a guy that was unconscious. I fell asleep while I was drawing. It's like 6 o'clock in the morning, and I'd worked a 12-hour shift. I fell asleep while I was drawing the guy's blood. I know, yeah, exactly. Oh my God! I don't know how long I was asleep, but all of a sudden I woke up and I had all the blood I needed, and it was really kind of nice, and I didn't mess him up. Boundary violations, in all helping relationships, maintaining appropriate boundaries is an essential part of developing a trusting relationship with a client. You have to know your boundaries. Why does my phone keep making
Messages. There goes the Swedish women.
It's a Swedish woman. Oh, it's Svenska. I don't have a message. I don't understand why it keeps making noise. Okay. Anyway, okay, so you need to maintain boundaries. You need to be very, very careful. I'm a fairly affable person, so a lot of times I joke with people. Am I crossing a boundary? These are questions that you have to ask yourself. But as a professional, of course, you know what you can say and what you can't say to people. Relationship boundaries must be maintained with delicacy, because some people want to get closer to you. Some people think that you're their friend, even though this is a professional relationship. And so you have to be careful. You have to gauge each individual as to how close you can actually get to that individual. Hugging on this reservation. That's up in Montana. Everybody, they hug all the time. You shake hands and hug somebody. That's what happens. Here, it's not that way. No. Okay. So people are going, oh, stay away from me. What's wrong with you? Okay. So you need to determine what those boundaries are. Now you have to be careful of boundary violations. Sexual relationships with clients are forbidden by all professional codes and represent the most common ethical complaints against helping professionals. Some people become counselors because they're trying to score. You know what score means? You know, okay. All right. They're predators. They're predators, and you have to be careful of these people, because they're part of your profession as well. So you have to be aware that they do exist. This person is looking for action. That's what they're seeking, as sad as that is. How prevalent is it? In one study, 7 to 8% of practitioners reported engaging in sexual intimacy with a client. This is egregious. This is ridiculous. Why in the world would they do these things? They can do a lot of damage to the client. They can do more damage to the client by being sexually aggressive with this individual than help them, certainly. So they're going to actually make the client worse. Sexual relationships can have seriously negative effects on the client. It can cause cognitive dysfunction, confusion. This person is confused anyway. That's the reason they're coming in to talk to you. And now you're creating a new boundary that you have crossed. Now you've crossed another boundary. So this individual may have a lot of problems due to that. Identity and boundary disturbance, as far as that's concerned, you never know. You never know what the client is thinking and where their head is. You should know this. This is what you're trying to determine. So you should know what kind of damage you're doing to this individual by crossing that boundary. Sexual confusion, of course, especially if the individual is talking, well, it really all depends on the sexual orientation of the client. It may cause all kinds of interesting sexual confusion. If the individual is heterosexual and it's a homosexual relationship, then it may cause all kinds of interesting, strange, confusing sexual confusion. A lot of times you'll get a client that is asexual. They don't know what their sexual orientation is, and they will, and that's what they're seeking. They're seeking to clarify who they are, and here you're not really helping them at all. What you're doing is you're creating a new problem for this select individual because they are sexually confused, and that's one of the things that they were trying to determine. Rage and feelings of guilt, depression, and emptiness, of course. Anytime you get into a relationship that is questionable, it causes feelings of guilt. And of course, this is what may potentially happen with your client. They will have feelings of guilt, and that will cause depression and eventually emptiness, of course, because the emptiness is because they cannot pursue this relationship because you are a professional and certainly you can't have anything to do with this individual, so it is an empty relationship. Except in the case of my friend, that was the only person in the area that she could possibly date. Self-destructive feelings, of course, the emptiness causes self-destructive feelings and the individual may commit suicide. Increased risk of suicide, well, increased risk of suicide due to the fact that that they have all these empty feelings, because now all of a sudden they have feelings. Where's this going to go? Potentially you're married, they're married, and of course they have done something that they probably shouldn't have done. Stay away from it, that's the whole point. But like I said, there are individuals who are counselors who are predators. Touch, accepting gifts, and self-disclosure by professionals are behaviors that have the potential to be boundary violations depending on the circumstances. So even just touching your client, you need to figure this out. It's kind of funny when you see Sarah and I together. Sarah's from Canada, I'm from Indiana. We have this large area of personal space that we maintain. So, you know, this is about as close to Sarah as I get because, well, she's Canadian. You know, they have a large personal space. Anyway, it's kind of interesting. But touching is one of the questions. You know, when I was, like I said, when I was up north, everybody hugs. They hug all the time. Everybody hugs everybody else. It's really kind of interesting. It's one of the ways that they greet people is by hugging them. It shows intimacy. But here, of course, it's not the same way. In Indiana, it's certainly not the same way. Really kind of interesting. It was really kind of strange because I hadn't seen these people in 50 years. Just had my 50-year high school reunion. Hadn't seen them in 50 years. And of course, I've been working here. I've been working up on the Fort Belknap Reservation where everybody hugs. So I wanted to hug everybody. They probably think that I'm some kind of an odd sexual predator because I'm hugging everybody. You know, guys don't hug other guys. You know, that kind of thing. They're Hoosiers. What do they know about hugging? Absolutely nothing, I can tell you that. They don't even hug their spouses. And here we are hugging each other. But it felt appropriate to me. I don't know. I haven't seen anything on the internet about me being oddly gay or something. I don't know. We'll see what happens. Okay, so you have to be careful. You have to gauge who this individual is. Do they want to be touched? Do they not want to be touched? How much personal space do you have to maintain with this select individual? I was watching a movie the other night, Spanglish. I don't know if you've ever seen Spanglish, but he comes home drunk, and his maid is standing there, and he starts talking to her, and keeps getting closer and closer, and she keeps moving farther and farther back. Just a little bit inappropriate. More damage can be done by overstepping boundaries than the help that has been previously given. So you have to be very, very careful as far as your client is concerned. Being from Indiana, it's easy for me to, because I have so much personal space that I try to maintain, it's easy for me to stay away from people if I have to. And if I feel really strongly about that select individual, I hugged my brother before I left, which was, I don't know, I'm probably the only person that's hugged him in the last 50 years, the poor guy. But, you know, I felt close to him. This is like the first time he's healed. He's got PTSD. He had PTSD pretty bad. But I felt like I needed to hug him, and I did. I gave him a hug. And he hugged me back. Kind of. Patted me on the back anyway. I don't know what that means. Get away from me. There's a difference between city ethics and rural, small-town reservation boundary ethics. And I was talking about this before. 7,000 people in the county, and this lady was looking for, she was not connected to anybody, and she found somebody, one of her clients, and she married him. And of course, she shouldn't have done that. If she'd been in the big city, somebody would have said something about it. But she was the only counselor within 150 miles of the town, so, I mean, who's going to complain about it? it's really easy for people as a city practitioner to maintain their boundaries with their clients because they probably gravitate in different circles and whatnot. But in this setting, in Fort Belknap, in Blaine County, which has only 7,000 people in it, it's a lot more difficult. It's a lot more difficult. And this lady she had an office, but she rarely used it. She would go to people's houses and counsel them. And she'd go to, well, she's kind of an interesting person anyway. But a little bit more difficult in settings like this. The desire to help the people and the community that you were raised in is very strong. And a lot of you have mentioned that in some of your discussions. You've mentioned the fact that you want to help the people here, and this is why you're going through this program. You want to be a counselor, you want to help the people here. They don't suggest that you do that. They suggest that you go someplace else. But remember, we're talking about, this is from, this textbook is from Indiana University. These people are Hoosiers. Lots of people in Indiana, not nearly as many as in New York and California, but there's a lot of people there. It's really easy to go from one small town to the next small town or another small town over there and not know anybody. But here, of course, we're dealing with a very set population. So the reality is that if you want to help the people here, go ahead. That's a good idea. Probably what will happen is most of the people that you counsel won't know you anyway. And what will happen if you do know somebody who comes in for counseling, you'll have to recuse yourself. You'll have to allow somebody else to do the counseling, if there is anybody else to do the counseling. When you know the client before trying to help them, you're maintaining a dual relationship, and you should try to avoid this, of course. But if you're the only one in the area, you don't have a choice. You don't have much choice. The problem is that you know this individual as Snort or Snuffy, or you know them from who they were before. And that may have something to do with the way that you treat them. You may have a prejudice, not against them, but you may have an idea of who they are. We see this a lot in high schools. In a high school where you've got the captain of the football team or the basketball team, you've got the head cheerleader, and everybody has these strange, interesting ideas of what their life trajectory is because she's the prettiest one, and he's handsome and strong, and he's got everything going for him, and all of a sudden comes into counseling. Well, you still have that idea that he's handsome and strong, and he's he's got everything going for him. Of course, he's 6'5", and you're 5'6". So that actually creates a prejudice against that individual, but you still have a stereotype about who he is. Well, he may not be that person at all. This is one of the reasons why we see successful people committing suicide. It's because they feel like they're a fake. This individual, despite the fact that he's a really good basketball player, he understands or she understands that is not that important. Basketball has this much importance in the real world, and they have all these other problems. But of course, we create these stereotypes in our own mind. He's got everything going for him. He's got a 4.0 in high school, so we have these ideas. And so this is one of the reasons why you shouldn't counsel somebody that you already know, because you already have a stereotype about who this person is, whether it's some insulting nickname or whatever. I went through high school with a guy that was the funniest guy in the world, skinny little guy. We used to call him Barney because of Barney Fife, and he hated it. Of course, we didn't find this out until later, that he hated it. But he kind of liked the fact that people that had a stereotype about him, because he grew up in a really difficult situation, but we didn't know that because he was always pleasant and everything was, and he was always funny, and he was Barney. So he accepted this idea, but he hated it because it was a facade that he was throwing up. This facade that he was throwing up, and eventually, of course, everything changed because he went away to college, and of course nobody called him Barney in college. And when you go away to college, nobody knows who you are. If you go away to college, nobody knows who you are. So you can become anybody that you want. This is one of the things that happens to people in the military. Military people can change their personalities every time they change. They change. Every time you go to a new base, you can change your personality. You can be anybody you want to be, which is kind of fun if you think about it. Every 2 years, I change my personality. I become, more aggressive or less aggressive. Or
everyone's a state football champion.
Exactly. Exactly. Of course, in the military, you could have been the best basketball player in the world. Nobody really gives a crap because, you're the guy carrying the saw. You're the guy carrying the machine gun. That's your job. That's the only person that they care about. That's the only person they care about. Be aware that if you take on this risk, you are possibly in ethical violation. So this is one of the things you need to think about. This is just one of the things that you need to think about. Another challenge during your professional relationship is how much information about yourself you should disclose to the client. Now, obviously, I disclose. That's the way I teach. I just tell you guys stories about what happened to me. I just talked about Barney. Actually, his name's Steve, but we called him Barney. Anyway, I disclose a lot of information about myself. It doesn't bother me. I'm older than dirt, so anybody that I know you don't know, probably. I don't usually talk about people around here. But when you're a counselor, a lot of people are very, very private, and so they will hold this information in. They won't tell them about themselves. The problem is the more you disclose, the more you're dealing with yourself rather than your client. And it also gives the client an out. The client doesn't really want to talk about themselves, and usually you have to draw them out. The more information you talk about yourself, the more the client's going to talk about you rather than themselves. So this is one of the things that you need to think about. Sometimes, and this is the way that I do things, sometimes I will give them information about myself so that they will feel more comfortable disclosing information about themselves. And that's just the technique that I use. There's not, I don't have a whole hell of a lot to hide, so self-disclosure doesn't bother me. Some individuals don't want to deal with their own self, so they become somebody else when they go into the counseling, into a counseling situation. They will not disclose any of their own information because all of a sudden they're the professional, and they won't disclose any information. They can sit behind wherever they are. They can sit in their chair and be the wise person. But me, I'm not that way. I tell you guys everything, even my ugly little stories. There aren't that many ugly little stories. I told you about all my ex-wives. I told you about being attacked by my first one. I told you that I don't know anything about cell phones. Obviously, there's something wrong with it. Self-disclosure should only be used in best interest of the client, certainly not the practitioner. So, and of course this happens. Sometimes the guy will be saying, well, I'm a really good basketball player. And you say, well, I played on the state basketball championship team of 1926 or whatever. You're disclosing that kind of information. It becomes a one-upsmanship, and you really don't want that to happen. You need them to disclose as much information as possible. After the dance is over, after you're done with these people, you still need to maintain those ethical boundaries. You should. However, if something happens during counseling, you need to wait for 2 years before you can have anything to do with this person. If the relationship is that strong, 2 years isn't that long a time. I'm kidding. I'm kidding. If I meet somebody that I want to marry, well, it's happened to me 3 times. If I meet somebody that I want to marry, I'm not going to wait for 2 years. It's just, I'm not even going to wait 2 weeks, probably. I know. I need more self-control. Don't worry, I'm more self-controlled now. I'm a really old man, so I don't have to worry about it. After the professional relationship is over, all ethical strictures are removed. But a practitioner needs to be careful about how much contact they have with an old client to avoid damage due to confusion. You know, all of a sudden you become their best friend? Probably not. Not a very good idea. Because as their best friend, of course, now the relationship has changed. When you are in a relationship, it is not an equal relationship. Friendship is equality between you and the other individual. But this is not an equal relationship because you have a superior position over the other individual. You are giving them information. You are helping them. So it's not an equal relationship. So how in the world can you ever start a friendship with a select individual when there is that much power differentiation between you and them? You can't be their friend. You can't be their lover because all of a sudden, well, you have a power over them, and so you really need to be very, very careful about this. There is a power differential that will be there. Seeing you out of the professional context may disclose vulnerabilities that they didn't realize before, especially if you're one of those counselors that doesn't disclose a lot of information. It will be difficult to accept this client professionally in the future because now you've got other information about them. Maybe it's other information that they didn't disclose before. So now everything has changed. So the best way to do this is try to stay away from your clients. In an urban setting, that's easy. That's the easiest thing in the world. You live in Manhattan, they live in the Bronx. You know, you're never going to come in contact with each other. Here, everybody meets down at Bosch's in Chinle or over at the gas station. So you're going to see these people all the time. Most codes of ethics discuss the following ethical issues related to assessing clients. The assessment procedure or instrument should be within your scope of practice, education, and training. In other words, if you've never used the MMPI, you haven't been trained to use the MMPI, don't give anybody the MMPI, the Minnesota Multiphasic Personality Inventory. It's 563 questions. I don't know, they keep throwing questions out. Anyway, it's a lot of questions. And if you haven't been educated and trained how to use this thing, why in the world would you give it to them? Clients should be fully informed about the procedure and be included in the procedure in a collaborative way. In other words, you need to tell them what you're going to do and how you're going to do it. We're going to have 15 counseling sessions. I'm going to use Jungian psychology, a Jungian technique. We'll start out with the Jungian technique, and we'll see where we can go from there. If I decide to change my approach, I will tell you, and they need to agree to that. Appropriate instruments, for example, if I said to a client, somebody called me. I think. Is that a telephone call? Yeah, I got a telephone call. Unfortunately, contacts have stopped. I don't know what that means. Who called me? It doesn't say. Oh, okay. I don't understand. Okay. Okay, so let's say that I'm talking to a client and they say, well, we're going to use Freudian psychology. Well, the individual understands, or you need to tell them that Freudian psychology deals with me delving into your childhood, trying to find out why you have the ideas that you have. That's what Jungian or Freudian psychology is all about. So if they don't want you delving into their past, they don't want you to talk about childhood because, I don't know, they were molested by their father, their mother, or whatever, or Uncle Charlie or whatever. If they don't want that to happen, then they can nix the whole thing. They can say, no, we're not going to do that. We're just going to deal with it here and now. So you need to be collaborative as far as what techniques you're going to use on your client, with your client, not on your client. Sounds like we're torturing them, taking them down to the basement, attaching them to the wall. Appropriate instruments or procedures should be selected based on the assessment question, and of course, that's the way it works as well. Assessment instruments and procedures used should be standardized and include normative data appropriate for culturally diverse or disabled clients. In other words, if we're going to use something with an individual that is Hispanic, we need to make sure that it has been standardized with Hispanic people, with a Hispanic population. how many instruments are there out there that have been standardized using a native population? That's a question. I happen to have this information because, well, I've studied this stuff. The MMPI, interestingly enough, initially was standardized using a native population. Not exclusively, of course. There aren't that many natives around. Why would you do an MMPI just for natives? It doesn't make any sense. But it was standardized using natives as well. So at least the MMPI has been standardized that way. The COMPASS test, I don't know if you, when they decided what classes you should go into, the COMPASS test was standardized using a native population, as compared to all the others that didn't. When administering, scoring, and interpreting instruments, appropriate procedures should be adhered to. Clients should be given a clear and complete explanation of the assessment results. And this is something that used to not happen. Now, one of the things, and I've told you this before, I came from a class, there were 72 of us in the class, and 18 of us scored such high, we had such high IQs that we were geniuses, and they couldn't figure out why there were so many smart kids in this one little rural town of this farming community, this factory worker community. It just didn't make any sense to anybody. So we're trying to figure this out. We were guinea pigs. They tested us over and over and over again. But they never told us what the hell was going on. They never told us that they were going to do this. They told our parents, but they didn't tell us. Oh, don't tell him. You know, they were saying that will skew our results. You can't possibly tell these individuals that we're using them as guinea pigs. So we were used as guinea pigs for like 12 years of high school. It was 12 years of schooling. All test and interview data should be kept secure and released only to individuals who are competent in interpreting the data. And this is one of the reasons why when you go in to talk to the doctor, the nurse says, we have your results, and you say, well, what are they? And the nurse says, I can't tell you. Wait till the doctor comes in and he'll give you the information. And then the doctor comes in and he gives you, you took all these tests and he tells you one thing. And you go, oh man, but I took like 15 tests and you gave me one piece of information. So then the nurse comes in and you say, this is all the doctor told me. And then she'll look at the stuff and she'll tell you what happened. She can interpret the results. The doctor's supposed to interpret the results. Theoretically, he's interpreted them to the nurse, so now she can give you this information as well. Or maybe she's not really supposed to give you that information, but hopefully she will. Normally, since I'm a lab tech, I just tell them, send me the stuff and I can interpret it myself. Dumb bastards, you don't understand this stuff anyway. I understand it better than you do. I'm the one that did the damn test. Informed consent means full disclosure of the purposes, goals, and techniques and procedure rules for assessment and counseling approaches used in language that is understandable to the client. In other words, you have to ask them, you have to tell them what you're going to do. That's informed consent. You have to tell them completely what's going to happen to them. Do you want me to use Freudian Union or voodoo on you? I think that's just hilarious. Anyway, that's informed consent. You have to tell them what's going to happen. Legal violations are distinct from ethical violations. Ethical challenges are generally brought before a state licensing board that can originate from a professional organization. Legal obligations to clients include duty to care. In other words, you have to care about your clients. You have to give them care. You have to help them. Duty to respect privacy. You have to be confidential. Can't give anybody information. Duty to maintain confidentiality. Duty to inform, duty to report, and duty to warn. Duty to warn has to do with danger. If they are a danger to somebody else, you have a duty to warn that select individual. And one of the things that will happen as you are counseling these individuals, they start thinking that you're a friend, that you can't disclose any information about anything. But the reality is, if they are a danger to somebody else, it is your duty to tell that person that they are in danger. If they're talking about beating up their spouse, you have a duty to that spouse to inform her that this guy has informed me that he's thinking of beating the crap out of you.
Wouldn't that be the same thing as breaking the confidentiality with if you were to approach the wife, something like that? No?
This is the question that has been asked since the 1970s. What happened in the 1970s? In the Tarasov case,
Yeah. I was trying to look
there we
back
go.
to the article I was reading.
There you go. In the Tarasov case, what happened was, this guy told his counselor that he was going to kill his ex-girlfriend, or this girl that he wanted to be his girlfriend.
It wasn't his girlfriend, it was someone he just got obsessed
He'd been
with.
stalking.
Yeah,
her.
he was
He
stalking
had
her.
become obsessed with her. Anyway, so the counselor, because of confidentiality, couldn't disclose this. And actually, he did try to call the campus police. It was a campus situation. And of course, the campus police are kind of like the campus police here. It's not like they carry weapons around, or that they could do anything, or chase anybody down if they needed to chase anybody down. So what happened, the guy went over to her house and shot her and killed her.
Yeah.
And the family sued, the Tarasov family sued the counselor because he didn't disclose this information. And that's in California. Now you have to remember, California has
Yeah.
different laws than everybody else. But this is part of the APA now, that you have the responsibility to disclose this information. You have to protect as many people as possible.
Yeah,
You know, I talk to you and you tell me that that Aaron is just the biggest jerk in the whole wide world, and the next time you catch him in the elevator, you're going to pummel him to death. You know, I have the responsibility, despite the fact I'm not your counselor. I mean, you gave me this information. I have to tell Aaron to be careful, to stay away from you. You know, because the next time he gets caught in the elevator with you, you're going to take him out. But you never get caught in the elevator with him. You don't have to know.
I take stairs.
You're okay. Peek in there before you go in. See, that would be my responsibility. I don't want anybody to get hurt. Yes, ma'am.
Yeah, the recommendations include warning the potential victim, hospitalizing either voluntarily or involuntarily the patient who voices the threat, or notifying a law enforcement agency in the vicinity of the patient or in the locale where the potential victim resides.
Right.
And it's actually up to the counselor if they do want to go about that. So that's why the law just left it open to interpretation what actions would discharge the duty to protect an intended victim.
But there's always a danger.
Yeah.
I could get sued.
Yeah.
Yeah.
So that's why they say it's up to you as a counselor.
Yeah.
It's your discretion.
So we're talking about boundaries here.
Yeah.
Just how close do I
Yeah.
get? You know, what do I do?
So it's not an actual law or rule. So it's
Right.
really just up to you whether if you feel safe doing it or not.
Stephanie's talking about offing herself. So what is my responsibility as far as she's concerned? I don't really think she's going to do it. But she said it, and if something bad happens, then if you have this ideation, now you may carry it out. So I have to call up the police and say,
Yeah,
this lady's thinking
hospitalization.
of committing suicide. So now they have to put her on suicide watch. But then she can come back and sue me.
I wasn't going to do it.
I was just kidding.
I only said it 3 times. If I said it 7 times, it would have been different.
What I tell you 3
According
times
to
is...
statistics, that's more than 7.
Exactly. Exactly. So this is a tough one. I mean, this is a tough one. If
Yeah.
somebody gives you that kind of information, you should know your clients. I should know whether you have the inclination or the desire to really injure Aaron. Now, on the other hand, if he was the one threatening you, I know what his skills are. So I would have to take that really seriously if he's talking about doing something.
I would take off.
Like there's a mountain right there, and I'm going to hear from Aaron for a while.
It's a rule of 7. All right. I didn't say it once.
How many times you say that?
Exactly. So we have to be really careful, and you can get into a lot of trouble, damned if you do and damned if you don't. This
Yeah.
is the problem, is the biggest problem. But you don't want anybody to die. So it might not be a bad idea. And I always, we had a situation in Ashford where I thought this kid was fragile and that I was afraid he was going to commit suicide. My colleague just wanted to kick the guy out of class. Hadn't been coming to class. And draws pictures in the back of the room. He was gonna throw the kid out of school because he wasn't doing this, and I told him, you know, he's kind of a fragile kid, you better be very careful. And so I called in the counselors at Ashford. When the kid came into this guy's office to be kicked out of school, I told him, you know, we better have a backup. Of course, he's going, no, because I'm not worried about it. He's a jackass anyway. It was that kind of a situation. But I thought he was that fragile. So I erred on the side of caution in this case. And of course, the kid goes, I'm not going to do anything to myself. What's wrong? You know, what are you doing? But then again, if the counselors hadn't been there, he might have left the office and gone over and hung himself someplace. But because we showed concern, nothing happened. Err on the side of caution. But you can always get sued at the same time. Confidentiality is not absolute, obviously. Laws vary by state. California has probably the most stringent laws. Other states have different laws. Arizona tends to follow California, strangely enough. I don't know. Let's not talk about how Arizona doesn't do what they do, whatever California does. It's important to keep up to date in your own state's laws concerning confidentiality requirements and expectations. This has been changing over time, and one of the reasons it's been changing is because things are getting more conservative, and because they're getting more conservative, the states are changing their laws. So some of these confidentiality laws are becoming more conservative. As strange as that sounds. I know. Malpractice is defined as negligence in which the professional fails to follow generally accepted standards of the profession, resulting in injury to a client. And that is malpractice. Something has happened, and something happened to the client because of something that you did. The client must prove 4 things about the practitioner to recover damages. They need to prove that the practitioner owed the client a duty to conform to particular standard of conduct. In other words, if you were put your hand on the client at a strange moment, then that is you're not following the standard of conduct. So they need to prove that. The practitioner had an obligation to follow defined standards of care. So if you were doing, I don't know, Beckian or Elysian counseling, and you didn't take it far enough, of course, then you didn't fit the standards of care. But they have to prove that. They have to prove that normally when somebody is under this type of care, that this is what happens. The practitioner breached that duty by some act of omission or commission in the professional practice. Omission means that you just didn't do it, you just kind of forgot about it. You didn't do something that should have happened, but you didn't think about it. Commission means you did something specific. Omission means you forgot. Commission means that you did something that you shouldn't have done. That's a commission. Omission just means you left it out. You omitted it. My wife talks about this all the time. She's Presbyterian. And evidently in the Presbyterian church they talk about sins of omission. Sins of omission would be a sin that you committed just because you didn't think about it. That's a sin. It's like if you have to make a decision whether you're going to go to the store tonight or not, and you sit there and watch television, sit there and watch television, sit there and watch television until it's like 11 o'clock at night. You're not going to go to the store at 11 o'clock at night. That's a sin of omission. In other words, you just kind of put it off and put it off and put it off. So you omitted it. But commission is where you do the wrong thing. Okay. The client or others suffered measurable damage or injury, and you can show that this happened. Maybe they committed suicide, or maybe they attempted suicide. So there is damage because of the counseling that you did. The practitioner's conduct was the direct or proximate cause of the damage, of course, and it's because you didn't say something, you didn't do the right thing. And that's what they have to prove. What's the probability of them being able to prove any of this? If they can get another counselor to testify against you, then possibly they can actually get it done. But otherwise, it isn't going to happen. The top 5 reasons for malpractice in the United States are incorrect treatment. Usually this has to do with some odd treatment, some strange treatment, something that people don't normally see, so a new counseling technique, and usually that's why they have the incorrect treatment. If you've ever watched Dr. Phil on television, Dr. Phil's really fascinating to me because he's an Elysian. Ellis is the kind of guy that confronts people. He tells them what their problem is, and he tells them to stop it. That's how Ellis cures people. And that's the way that Dr. Phil does it. Of course, Dr. Phil was never really a counselor. Dr. Phil was a jury consultant. And he reads people. That's his job. He reads people. But normally a counselor, you can't cure somebody in 30-minute television show normally. That's not the way it works. You have to have them come in time after time after time, and you need to talk to them, and they need to cure themselves. But that's not the way Dr. Phil does it. Dr. Phil tells them what the problem is. He tells them to stop it. Okay. Is that incorrect treatment? Well, it's Elysian treatment, but is it incorrect? I don't know. It may make somebody do something strange. Sexual impropriety is number 2. This is very, very relatively common. We saw 7 to 8% of the individuals are committing these problems, or doing these things. It's usually male counselors. It's not female counselors. But it can be female counselors. We have all watched the movie Suicide Squad. We all know who Harley Quinn is. Harley Quinn was the Joker's counselor. And of course and now she's a criminal. She's an arch criminal. She was a psychiatrist, and now she's an arch criminal. So that can potentially happen, of course. Normally it doesn't happen with women, it happens with men.
They sink psychologically.
I'm sorry?
I said they sink.
Oh, they sink psychologically. Yeah, they are kind of funny, isn't it? Or not. I don't know. I don't know about Harley Quinn. I haven't quite figured this one out. Anyway, sexual impropriety. One of the things that happens in a counseling session is the person doesn't really want to talk about their problems. So they'll try to distract you in any way that they can. Whether it's a female or whether it's a male, they'll try to distract you any way that they can. And flirting is a really good way to do that. Especially if it's a female client and a male counselor. Males have this really strange ego going on, and they think that they are attractive to everybody. They think that they're attracted to everybody, no matter what they look like.
Yeah.
I don't know. This is actually a counselor that has been indicted. He wasn't convicted, he was just indicted. He's 6'6", is that right? 66, yeah, 5'6". 5'6". Yeah, he's 5'6". Yeah, a little short twerp with a big beard. Strange glasses. Yeah, he's real. Yeah, women just fall all over this guy. Anyway, sexual impropriety. So one of the things that will happen is people will flirt with their counselors, and the reason they do this is because they don't want to talk about their real problems. So they're trying to distract the counselor. So these kinds of things happen all the time. So whose fault is it? If she's flirting with him and he reacts to her, is it his sexual impropriety or hers? It's his. It's his. He's the professional. And he should know that she's trying to distract him. He shouldn't be deluded to the extent that he thinks this stripper's madly in love with his beard or something. I don't know. Anyway, breach of confidence, of course, is another problem, is number 3. Failure to diagnose or incorrect diagnosis. The reality is we have to diagnose people in order to get paid. We have to label them with a problem. They're depressed. They have anxiety problems. Hopefully it's nothing worse than that. But we have to diagnose them. And if we don't diagnose them, then the insurance companies won't pay us. So we have to diagnose them. But if you give them a diagnosis that is incorrect, or is one that is far worse than what it actually is, then that's an incorrect diagnosis, and they can sue you for that. So you have to be careful. And of course, if your patient commits suicide, this is the 5th reason for for bringing malpractice a suit against your practitioner. If a practitioner loses in court, there may be several consequences. They might be fined for damages. They may be given punitive damages. In other words, they have to pay a lump sum. Or they may have to pay for further counseling with somebody else. They may lose their license. Of course, they're going to lose their reputation. Future difficulties in obtaining malpractice insurance because they've already been sued once. The court case, whether won or lost, might damage the practitioner financially, emotionally, or professionally. And of course, he has a failure going on here, and of course, he has to live with that. But the biggest problem is malpractice insurance. And one of the things that you need to think about, well, I don't know, you don't have to, I guess. A lot of people will join an organization because they will pay your malpractice insurance. If you are working by yourself, you have a single person practice, the malpractice insurance is kind of high because this is always a possibility that people will sue you. Minimizing the risk of ethical or legal challenges, adhere to up-to-date practice methods. You need to document what's going on, you need to write it down. I'm a person that doesn't write things down. I never make lists. So I would get into a lot of trouble. And I've actually, in my educational career, I've dodged a couple bullets somehow. But if I had written everything down, I would have been in better shape. Maintenance of appropriate boundaries with your clients. Try to stay away from multiple relationships. Multiple relationships have to do with they're your friend on the outside, they're also your client on the inside. That's a multiple relationship and should be stayed away from. The following activities may lead to malpractice. Sexual relationship with your client, of course, is number one. Practicing beyond your scope of competency. You have been trained in a select way. That is the only way that you can practice counseling. You need to stay away from things that you haven't been trained for. If you are an individual counselor, you can't do family practice unless you have that expertise, unless you have that information. Fraudulent billing is a huge one. Lawyers do this all the time. Anytime they're thinking about your case, they can bill you for that hour that you were thinking about it. But this also happens with counselors. A violation of reporting laws, you didn't report things properly. A breach of confidentiality or refusal to provide records to the courts. Okay, so this is one of the reasons why you need to write everything down. So they're going to say, well, we didn't really have a counseling session. And of course, if you did have a counseling session, they will forget a lot of stuff. Clients will do that. Sometimes it was too painful for them to remember. We try to forget all the bad stuff if we possibly can. So they will forget things. So you need to write everything down. You really need to document just about everything. And this is one of the reasons why when you go in to see your doctor will be typing the entire time you're talking to them, because they need to record everything that's happening. I have no idea why I put that picture up there. Ethical dilemmas involve making a choice between two or more relevant but contradictory ethical directives where every alternative results in the same type of undesirable outcome for one or more persons. So you're damned if you do and you're damned if you don't. It's one of those you're damned if you do. This is a situation where there is no positive outcome. Everything is undesirable. So, good luck. Reamer in 1995 describes two principles that can guide practitioners into resolving ethical dilemmas. Beneficence, where the practitioner should take action intended to help or benefit others. If you're always aiming in this direction, and some counselors, of course, will try to protect themselves, but you need to make sure that everything that you do is for your clients. If you do that, then you should have no problem. And that's what Reamer said in 1995. Non-malfeasance, where the practitioner should act without malice in order to do no harm. No matter what this person says to you, and actually you're going to have clients that come in and they're going to swear up and they're going to use all the words that you don't like, whatever those words happen to be, and they'll find them. And they'll come into their counseling session screaming at you in the most obscene terms you can possibly imagine. Why? They're trying to distract you. They're trying to redirect the counseling sessions. They don't want to talk about their problems. So you can't try to do damage to your client. You should have no malice at all with your client. These are all your best friends. That's the way I feel about my students. I love all my students. So I don't want to hurt anybody. I want to always move in a positive direction, and I don't want to ever hurt anybody. And this is what I did when I was working in medicine. One time, I got in trouble. This is when I was in the military. I didn't salute this guy. I didn't salute this guy, and I had an excuse, but it was a stupid excuse, and I should have saluted him. I hated saluting when I was in the military. Anyway, so he reprimanded me. He reprimanded me, and I was supposed to do this and this and this and this. You know, I'm supposed to do all these things. I've got 4 stripes. I should have known better, and I did know better. I was just being a jackass. I know. So guess what happened the next week? His son came in for emergency surgery, and I was the one that went down to draw his son's blood. And I knew who this kid was because he had the same last name as his old man. And his old man is a jackass. Well, actually, I was a jackass, but he was a jackass. So, you know, I could have missed him. I could have, you know, I could have called somebody else in, and of course he needed emergency surgery, so they had to take him in right away. This is an emergency. You know, I could have done all kinds of horrible stuff to that kid. No, no harm, no malice. And it was hard because his father just, you know, he was one of those guys with a thing up his butt. Anyway, it was with a stick up his butt. He was, yeah, and he reamed me up one side and down the other. I mean, it was terrible. So all of a sudden, I could pay this guy back by missing his son, taking a little bit too much time. I could have done all kinds of things, but I didn't. I drew his blood. And of course, this is all roaring through my mind. I've got this whole schizophrenic thing going on in my head. I can pay him back. You know, one of those kind of deals. But I was such a professional. I know, what's wrong with me? I can't pay anybody back. Then I drew his blood, and he had horrible veins. He had just the worst veins in the world. And I still was able to get him and draw his blood without any problems. I mean, I had all the excuses. I could have done it, but I didn't do it because I was a medical professional. And I drew his blood, and he came out of surgery. He had a strangulated testicle, which I know exactly. Exactly. I kind of felt sorry for him.
I think that's enough, yeah.
Yeah, just hearing what his problem was makes me sick. He wore his pants too tight, and he had strangulated his own damn testicle. And for that reason, I could have missed him for being so damn stupid. He wore his pants so damn tight, he strangulated his testicle. No, I drew his blood, everything's fine. And his father, when he came in later and he saw that I was the one that was taking care of his son, you know, he was afraid I was going to stab him or something. I don't know. His son survived. Elaine Congress, and I didn't have to do all those things. He later realized that everything turned out good. Elaine Congress, a social worker, came up with the ethic model of decision making in 2000. When you come up with one of these ethical dilemmas, it's tough. It's really, really hard. And you need to figure out, what the hell am I going to do next? How am I going to make this ethical decision? Because remember, it's a damned if you do and damned if you do, because there are no positive solutions. You're going to get stung no matter what happens. So you have to make these ethical decisions, and she came up with this idea as to how you come up with the ethical decision. E, examine all of the relevant client, personal, agency, professional, and societal values, including personal, societal, cultural, agency, client, and professional values. This is kind of tough. One of the things that will happen to you if you work for an organization, they will have their own ethical standards. And usually these ethical standards just follow the APA guidelines or the social work guidelines or the family practice guidelines normally. But sometimes they have policies that don't quite fit. So what do? Do you do what the APA tells you to do? Do you do what the state tells you to do? Do you do what the federal professional guidelines tell you to do? Or do you do what your agency tells you to do? What do? If your agency is unethical, who do you follow?
Probably the state.
I'm sorry?
Maybe the state.
I don't know. Do you want to keep your job?
Yeah.
Well, that's the question. I mean,
Yeah,
and this
that's
question
the
comes
part.
up all the time.
Yeah.
Do you do what you know you should do, or do you do what might
Thinking.
get you fired because it goes against the ethical standards of your agency? Which maybe they're doing this because they're trying to save money, or they're trying to make money, which is more irritating than anything. But what do you do? And everybody has a different answer. If you're a company guy, you're going to do what the company tells you to do.
It's true. Now, is this where one's personal moral ethics as far as work comes in?
Sure,
Is this where it begins to play into this choice?
it does. But you got to remember that if you do what you think is best and it goes against your company policy, you may get fired. You will probably get fired. Yes, ma'am?
But wouldn't you be able to take that company to another organization as
Potentially. How much money do you have and how long?
well?
Okay, I know that's the problem. The military. Sometimes the military tells you to do things that you know is wrong, that ethically and morally it's wrong. You know it is. You're not supposed to do that kind of thing. You know that that's wrong. But the organization tells you to do something that's wrong. You've been ordered to do the wrong thing. My Lai is a perfect example. They told these guys to go in and kill everybody in the village. So do they do it? Or do they not do it? Do they follow orders? This isn't, they're not going to tell you to go in and kill a whole village full of people, of course, but I mean, at the same time, sometimes agencies have unethical practices. And a lot of times it has to do with billing, it has to do with fraudulent billing. And if you don't do it, you get fired. And they find somebody who's a company man that will do all the horrible things that they want them to do. Okay, all right. So this is an ethical dilemma that a lot of people come up against or with or for, whatever preposition you want to use. Think about ethical standards of your professional code of ethics and relevant laws. That's the T. The H, hypothesize about all the possible consequences of different decisions. And if you've ever had been in this kind of an ethical dilemma before, you play this over in your mind. You can't sleep at night because you're thinking about, well, if I do this, this is what's going to happen. What do I want the outcome to be? The outcome I want is for me to keep my job and for me to do the right thing. But if the agency doesn't want me to do that, now I've got a really serious problem. So what do? How mercenary am I? How badly do I need that job? Is the other question we have to ask yourself. Now here I don't have to worry about it because I can retire anytime. I'm 67. I get Social Security. I don't need this paycheck. So if Dene College asked me to do something that I didn't like, I could just quit. I know. I wouldn't though. I love you guys too much. I'm not real crazy about the administration, but then again, I'm never crazy about the administration. I'm always crazy about my students. And I'm going to do what's the best for you guys.
That's what I was going to say. In this situation, you would do what's best for your patient, your client.
Exactly.
In order to protect yourself, whether you lose out in either field or not.
I could do that because I've got a rich wife.
Oh, that helps.
Okay. If I were a single parent and I had a home full of kids, and this is my income, well, what's my choice? This is a damned if you do, damned if you don't situation. Okay. How long does it take you to get unemployment? Months? Yeah, you're not
But
gonna-
you do have alternates in choices, because I have friends who are counselors, and one in particular has met into a situation similar to this a while back. And the decision was, I'm not gonna stay here forever. I'm seeking other employment
Sure.
with hopefully a company that has better morals and values.
That's a possibility if there is more than one company in the area. If this is the only if you want to stay on the reservation and this is the only counseling between here and Flagstaff, what's your choice?
Find a new location.
Find a new one. You're going to have to move, and it's going to cost you a pile of money, unfortunately. So these are the dilemmas that you're hypothesizing while you're trying to pretending to go to bed and not sleeping, thinking about all your problems. Identify all that might be benefit, who might be harmed. It is often necessary to research potential consequences of possible decisions on all those involved. So these are things that you have to think about as well. Consult with supervisors and colleagues as you begin to formulate choices. When a supervisor, colleague, or consultant is involved, the final decision must take their thoughts into consideration. In other words, you may be hurting somebody else. When I'm told to do something downstairs, I have to do this. Usually I did it as quickly as I could, because if I didn't, Sarah would get in trouble. I certainly didn't want Sarah to get in trouble because I was being a jackass. Okay. Okay, I'm a jackass a lot. I apologize for that. I wish I weren't. I wish I were a better person. Anyway, so you have to think about your supervisor as well. You may not be the only one being fired. It may be them as well, because they can't control you. Or they've given you this flexibility, and now they're going to get in trouble because you didn't do what you were told to do. When you're in the military, somebody ordered you to do it, and if you don't do what you were supposed to do, you get in trouble, sure, but they get in trouble as well. So it all depends on how much you like that guy or that lady as to whether you do what you're supposed to do or not. When I broke the law, and I did break the law when I was in the military, I was dating my boss, I knew that both of us could get in trouble. It didn't happen. It could have happened, but it didn't happen. And I guess I'm lucky. But these are things that both of us were thinking about. And my wife is more of a Boy Scout than I am. I'm willing to take a chance and get in trouble. That's okay with me. She's never been in trouble in her whole life. This lady is a straight arrow. Here all of a sudden she starts dating one of her subordinates. That was, wow. She's very linear. She always goes in the right direction. Here, all of a sudden, she's curved off to this trajectory. She's taken off. Yeah, I know. I told you why she started dating me, didn't I? I was on the softball team. I was a third baseman on the softball team. She's madly in love with me. Yeah. Well, I'm kind of cute. Well, maybe not that cute.